Hello my dear friends, this is a video about Joint Commission International Accreditation for Hospitals. In this video, we will talk about general eligibility requirements for any hospital to be accredited by Joint Commission International. For more videos, please visit my Facebook page, Healthcare Quality, or my YouTube channel, Dr. Hassan Kamel. The hospital is located outside of the United States and its territories. The hospital is currently operating as a healthcare provider in the country, is licensed to provide care and treatment as a hospital, and at a minimum does the following. 1. Provides a complete range of acute care clinical services, diagnostic, curative, and rehabilitative. 2. In the case of a specialty hospital, provides a defined set of services such as pediatric, eye, dental, and psychiatry, among others. 3. For all types of hospitals, provides services that are available all days. Ensure all direct patient care services are operating 24 hours per day, 7 days per week, and provides ancillary and supportive services as needed for emergent, urgent, and/or emergency needs of patients 24 hours per day, 7 days per week. The hospital provides services addressed by the current JCI accreditation standards for hospitals, and the hospital assumes or is willing to assume responsibility for improving the quality of its care and services. The hospital is open and in full operation, admitting and discharging a volume of patients that will permit the complete evaluation of the implementation and sustained compliance with all the current JCI hospital accreditation standards. The hospital meets the conditions described in the accreditation participation requirements. If the applicant is an academic medical center hospital, it must meet each of the criteria above, in addition to the following 3 criteria. 1. The applicant hospital is organizationally or administratively integrated with a medical school. Number 2. The applicant hospital is the principal site for the education of both medical students, undergraduates, and postgraduate medical specialty trainees from the medical school noted in Criterion 1. Number 3. At the time of the application, the applicant hospital is conducting academic and/or commercial human subjects research under multiple approved protocols involving patients of the hospital. Then we have some important definitions. Full operation. The hospital accurately identifies the following in its electronic application. Number 1, all clinical services currently provided for inpatient and outpatients. Those clinical services that are planned and thus not identified in the EAP and begin operations at a later time will require a separate extension survey to evaluate them. Number 2, utilization statistics for clinical services showing consistent inpatient and outpatient activity levels and types of services provided for at least 4 months or more prior to submission of EAP. Number 3, all inpatient and outpatient clinical services, units, and departments identified in the EAP are available for a comprehensive evaluation against all relevant JCI standards for the size and type of the organization, such as patient tracer activities, including individual patient and system tracers, open and closed medical record review, direct observation of patient care processes, interviews with patients and interviews with medical students or trainees. We should contact JCI accreditation prior to submitting an EAP to discuss the criteria and validate whether the hospital meets the above criteria for in full operation at least 4 months or more prior to submitting its EAP and at its initial survey. JCI may request documentation of the hospital utilization statistics prior to accepting an EAP or conducting the on-site survey. In addition, JCI will not begin an on-site survey, may discontinue an on-site survey, or may cancel a scheduled survey when it determines the hospital is not in full operation. The second definition is principal site. This means the hospital provides the majority of medical specialty programs for postgraduate medical trainees, and not just one specialty, as in single specialty hospital. Medical research. Medical research conducted at the academic medical center hospital represents varied medical areas or specialties within the institution and includes basic, clinical, and health services research. Such researches may include clinical trials, therapeutic interventions, development of new medical technologies, and outcomes research, among others. Hospitals that primarily conduct non-human subjects research and or research exempt from the review of an IRP or research ethics committee, such as medical record review studies, case studies, and research involving data specimens without individually identifiable information, do not meet criterion 3 of the academic medical center hospital eligibility criteria. Note: if in its reasonable discretion, JCI determines that the applicant does not meet the eligibility criteria for the hospital or academic medical center hospital accreditation program, JCI will not accept the application or will not process the application for accreditation from the hospital and will notify the hospital of its decision. Thank you.